రైట్. అలాగే మీరు ప్రైమరీ హెల్త్ కేర్‌లో వర్క్ చేశారు ఇనీషియల్లీ. గవర్నమెంట్‌లో, ఎంఎన్‌జేలో కూడా వర్క్ చేశారు. మరి అప్పుడు గవర్నమెంట్ అంటేనే ఇప్పటికి చాలా వరకు చూస్తుంటాం. అక్కడక్కడ నెగ్లిజెన్సీ ఉంటది. సరిగ్గా ప్రాపర్ కేర్ ఉండదు. మరి అప్పట్లో ఎలా ఉండేది? వాట్ వర్ ద ఛాలెంజెస్ దట్ యూ ఫేస్ దట్ టైమ్?
So it all depends on individuals. If you want to do things, then you can do. You can blame somebody and say that because it was not there, I couldn't do it. So I mean, I had that passion in a Bhutpur primary health center. వాళ్ళు ఆ ఊర్లో గ్రామాల్లో పెద్దవాళ్ళతో మాట్లాడి వాళ్ళతోటి ఫైనాన్సెస్ తీసుకొని ఒక బిల్డింగ్ తయారు చేసాము. డైరెక్టర్ ఆఫ్ మెడికల్ సైన్సెస్ వాళ్ళ దగ్గరికి పర్సనల్గా వెళ్ళి కలిసి I could get some medicines, equipment to the primary health center. We used to do everything in the primary health center.
ఓకే.
So, that's again I'm saying it's all depends on the individuals. You can find reasons not to do, you can find reasons to do things.
Right.
That's what I strongly believe. I had the habit of saying never say no to anything.
Right.
So it is possible, it is possible. So that's the way it is. ప్రాబ్లమ్స్ అప్పుడు ఉన్నాయి, ఇప్పుడు కూడా ఉన్నాయి. చేసేవాళ్ళు కొన్ని ప్రైమరీ హెల్త్ సెంటర్లో డాక్టర్స్ అంటే దేవుళ్ళలాగా చూస్తారు. వాళ్ళు పొద్దునెళ్ళి రాత్రి దాకా ప్రతి పేషెంట్ చూస్తూ ఉంటారు. కొన్ని ప్రైమరీ హెల్త్ సెంటర్లో సంతకాలు చేసి వెళ్ళిపోతుంటారు. సో దిస్ ఆల్ డిపెండ్స్ ఆన్ ద ఇండివిజువల్స్. ఇఫ్ సంబడీ వాంట్స్ టు వర్క్ సిన్సియర్లీ దే క్యాన్ స్టిల్ వర్క్. విత్ ద లిమిటెడ్ రిసోర్సెస్ వీ క్యాన్ డూ వండర్స్.
ఆల్సో యూ వర్క్డ్ యాజ్ అసిస్టెంట్ ప్రొఫెసర్ ఎట్ ఎంఎన్‌జే అండ్ కాకతీయ ఆల్సో. సో అప్పుడు వాళ్ళకి టీచ్ చేస్తున్నప్పుడు యాజ్ ఎ డాక్టర్ వాట్ హ్యాస్ గ్రోత్ ఏం చూసారు మీలో మీరు? ఏం నేర్చుకున్నారు? అంటే స్టూడెంట్స్‌ని టీచ్ చేసేటప్పుడు కొంచెం ఇండివిజువల్ మైండ్ సెట్స్ ఉంటాయి. వాజ్ ఇట్ ఆల్సో డిఫికల్ట్ ఫర్ యూ? వాట్ డిడ్ యూ లెర్న్ ఫ్రమ్ దెమ్?
Basically, right from PG days, I was interested in teaching people.
Okay.
We used to get people from across other hospitals to learn oncology. I used to teach them every aspect of oncology. And even after leaving the government sector at Apollo Hospital, we started post-graduation training. Every day, and you can't believe, in Apollo Hospitals, Hyderabad, every day 1 hour we have teaching program. That is unbelievable. Most of the corporate hospital teaching anede undadu, pan cheskunta untaru. But in our hospital, under my supervision, every day we have 1 hour teaching sessions. So across the Apollo Cancer Hospital, PG students know, they get literally churned and they learn so many things. Practically as well as theoretically, everything they get to know. And we work from morning 8:30 to evening 7:30. So it can be taken as a negative thing. Some people doesn't want to join Apollo Cancer Hospital because they have to work 12 hours a day.
Yeah, okay. సార్ మీ ఎర్లీ ఇయర్స్లో ఏదైనా పేషెంట్ ఉన్నారా? లైక్ మీ పర్స్పెక్టివ్ని మార్చేసింది మెడిసిన్ మీద ఫర్ ఎవర్. ఎర్లీ ఇయర్స్లో మీరు వర్క్ చేస్తున్నప్పుడు ఏదైనా గుర్తుందా? ఏదైనా పేషెంట్ ఇన్సిడెంట్ కానీ ఏదైనా?
Yeah, couple of things, Amma. Especially when you are working in a government hospital. Right. I remember a woman coming with her father-in-law having a lung cancer. Okay. And then after he had an advanced stage 4 cancer, and we lost him in 6 months time. And 6 months later she brought her husband who had lung cancer again. And that man also, by the time we diagnosed it as stage 4, and we couldn't save him. So, and she was left alone. So both the patients had smoking habit. So that actually struck my mind, and I started working advocacy on anti-tobacco, anti-chewing tobacco. Wow. So since then I've been a strong advocating of anti-tobacco policy. And I met the government of Andhra Pradesh, combined Andhra Pradesh. Okay. I did a PIL also. And we stopped, we got the ban of pan and gutka, pan masala in Andhra Pradesh. But the implementation is so difficult, right, unfortunately. But I'm glad that we could do that, and we continue to do that. And whoever comes to my office with a cancer, I tell them that this is what it is. At least the people who are accompanying them, right, we counsel them to stop tobacco, chewing or smoking. Okay. This is as far as the prevention is concerned. So prevention is a most important factor, right, important thing even for the media. Unfortunately, media doesn't take much of a take on preventive aspects, but it is important. I keep telling the media that every newspaper at on right side and left side corner should have one caption of about prevention.
Okay.
Prevention could be anything, mainly oncology. I am an oncologist, so I would talk about that. But preventing cardiac prevention,
Awareness should be created.
awareness on accidents, prevention is the most important thing. So that way we started doing camps in villages, prevention and screening. So
Okay.
both the things, we keep on giving lectures and screening camps to detect cancer at an early stage. So these are things which we started way back in 25 years back, and we continue to do that. Awareness meetings in last 30 years, I have done 70, 72 awareness, huge awareness meetings. So that actually creates a lot of help in the society.
course.
And now we are, earlier we used to have 70 to 80% of the patients coming in advanced stages. Now 70 to 80% are coming in early stages.
Right.
So that's a big help to the society, and in that way we are able to conquer cancer. Any early diagnosed cancer patients are almost get cured, and with a minimal treatment. So
Right.
prevention and early detection are the most important components of cancer care.
Right. So cancer is not a glamorous field. Why did you choose this cancer oncologist path? ఎందుకు choose చేసుకున్నారు? Also we heard your uncle has helped you or told you to choose this path. So why, what made you to choose this cancer path? ఏంటి ఏం చెప్తారు?
As I told you, Amma, I always loved challenges.
Okay.
When I joined, of course, to join the oncology, my uncle was a cancer specialist and he was a superintendent of MNJ Cancer Hospital. So he said oncology is a challenging field, and I see that in you. You can take up challenges.
Okay.
You should join this. So when I joined PG, three seniors ahead of me, 1 year prior who have joined, they
Okay.
left the post graduation in midway. And then three PGs who joined along with me, they left after 2 months. So that was so frustrating and disturbing to them. So nobody was ready to do oncology MD, post graduation in oncology. I was the only guy who continued. And I'm lucky, I'm fortunate, and I think I'm blessed because I took that as a challenge. Things which are not moving the way you are thinking, that we need to change it. So that is what my life has been, and whatever I took up, I made sure that I'll win. So winning is my way of life. So oncology is such a field that you need to take every patient as a challenge, and that's the way you need to fight it out. Even if there is any chance of curing that disease, even if it is stage 3, stage 4, I work immensely on it, and how best that we can do things and make sure that the patient get cured.